cataractcoach.com. Phaco wound burn. This can happen to you, and it damages the cornea. Here's why it happens. So we have an anonymous resident who's operating. Filling the capsule bag with trypan blue. You know this part of the surgery. Here's the pre-op. Patient had a really dense white cataract. The patient's getting a nice, beautiful capsulorhexis, so that's not going to be the issue. You can see the intumescent nature of this lens. We did the needle decompression and completing a very nice round capsulorhexis, a little small though. So Facochops going to be performed here, buzzing in with the nucleus, into the nucleus with the chopper and the Facoprobe, trying to split it. There's a little bit of a crack. I like that. But what should you be looking at when you're critiquing this video? Look at the position of the Facoprobe. Why is it up against the right side of the incision? Do you see the needle within the purple sleeve? The needle is also pushed right up against the corneal wall there, the wall of the incision. That's not good. You're supposed to float within the incision, but in this case, we're not floating in the incision. Even now, still the phaco tip, the phaco needle is riding and rubbing against that cornea. Why? And the answer is the hand position. This is a resident who's not comfortable placing the hands in an appropriate position. Your goal in the surgery is not to place your hands where you feel most comfortable. No, it's to benefit the patient. Let the patient have 10 minutes of benefit here. So now after all that, when you pull out of the eye, look what happens. That cornea is burned, absolutely burned there. That's a problem. So the reason is dense nucleus, you're putting in more phaco power, and you're not letting the needle cool down. The phaco needle's rubbing against the sleeve and right up against the cornea. Here at the end of the case here, the IOL's in the capsular bag. That looks great. But look how many sutures are going to be needed to close this cornea. You put in the 2 sutures, it still leaks because remember the heat congealed that corneal tissue. The cornea is protein, like an egg white. Once you use heat and you cook the egg white and it goes from transparent into totally opaque and white, well, how do you undo it? You can't. And so in this case, the resident had to do suture after suture after suture. And look, there's still a leak there. Another suture being placed. So at the end, it required so many sutures for closure. This will also induce significant astigmatism, which will hopefully fade with time. And this patient is very fortunate because the result in the vision was actually pretty reasonable. The patient was 20/40 vision the next day, and we'll watch the patient over the next couple months to see the healing here. Don't take these sutures out of the cornea too early. You may need to leave them in there for a prolonged period of time. And you can see we made another incision there. Once we saw the phaco wound burn, we made another incision superiorly, a scleral tunnel, and finished the case that way. So closing up that conjunctiva, let's show you a post-op picture of the patient, and you can see just how many sutures were needed to close it, because that corneal stroma contracts when you burn it. So be careful, don't get a phaco wound burn. What's the most important thing? Float in the incision. Very important. And check out our teaching website, cataractcoach.com. Why aren't you signing up for the free daily email? Are you afraid to learn too much? Come on, this will make you a better surgeon, and it's free. Check it out.